So I really believe as a pharmacist, it's important that we give back to the profession and really help with different initiatives. And this is a perfect, I mean, I'm honored to be the executive director of the Pharmacy HIT Collaborative. It's been a real treat for me to give back so much to the profession and to make pharmacists more knowledgeable about health IT and what we really need to do in capturing clinical information and different workflows. And I have to say, Pioneer X has done a yeoman's job on making sure that those initiatives are embedded into your software, and you realize the importance of not just the dispensing portion of pharmacy, but moreover the clinical documentation.
Yeah. So one thing I think was surprising to me to learn about for the Pharmacy HIT Collaborative is really kind of what it is. It was one of those groups that I'd never even heard of until I worked for Pioneer. So for the people out here that are like me 2 years ago, just kind of tell us what Pharmacy HIT is built to do, and it's kind of the cross collaborative of all the people that seed it.
Yeah.
Sure. Well, as I said, it was formed in 2010 by the National Pharmacy Professional Associations and in August of 2010. So we're actually going into our 11th year. And then we opened it up to associate members in November of 2010, and we wrote our roadmap document, which had 100 strategies of what really was an environmental scan of where pharmacy really needs to be. But the main mission of the Pharmacy HIT Collaborative is focused on pharmacists that provide clinical services and how those clinical services are integrated into the national health IT infrastructure. And I think that that's the really important piece. We don't really get into the dispensing side of pharmacy, but really looked at as how pharmacists can integrate using and leveraging health IT. I actually wrote a paper on what we call digital transformation in the pharmacy for clinical pharmacists. And what digital transformation is really changing your business and leveraging technology to do your business better. And that's how we really approached the Pharmacy HIT Collaborative, was looking at what we really needed to do from a pharmacist standpoint with clinical services, and how can we standardize, bring the standards towards that, and really begin to develop the coding system that we use, such as the international coding system and the standards that are out there, the HL7 and NCPDP standards that are out there, and how we can leverage those so that pharmacists can standardize the clinical collection and sharing in an interoperable way information and data that they're collecting. I hear this so many times and especially from pharmacy vendors, we have to connect to another system and write an interface to another system. It becomes very, very difficult, time-consuming, and costly for the customers of vendors to do that. And we had some pharmacies that are trying to document in 15 different systems on the clinical side for MTM services and connection with other types of payers and other types of programs. And it just became too onerous for the pharmacists to provide those clinical services. So we had to work with the pharmacy profession and others to build the type of payment model to make sure that pharmacists can be paid for those clinical services. But instead of really forcing technology on our pharmacists with different types of technology, if we could just standardize and leverage the standards, we would be able to maximize the productivity of pharmacists in their practices. So it became seamless. Now, this is not a unique type of situation. We saw this a lot years ago on the dispensing side, when the pharmacy dispensing systems, I mean, I'm an older pharmacist, so I remember filling out a claim to all the different payers until NCPDP came about with the universal claim form, which then standardized the claim. So the pharmacists, especially the system vendors, were able to focus on the workflow in relationship to the dispensing functions, which made the pharmacist more productive on the dispensing side. So we took that same type of concept. If we can get pharmacists to work with their system vendors on building out the clinical functions within their system and focus on the workflow. So JCPP, the Joint Commission of Pharmacy Practitioners, I think it was back in 2013.
Okay.
They created the pharmacist patient care process, which are steps that are used and to make sure that pharmacists are capturing clinical information in a standard way, because we had pharmacists that were collecting information following SOAP notes and trying to document into other clinicians' EHRs, and it became just too cumbersome for the pharmacist to use. And so we really tried to work with system vendors, find a model of which we did with Community Care in North Carolina to really test the model to see if we can get the pharmacist, no matter what system they have, because we want to be vendor agnostic and make sure that those pharmacists were able to capture information in a very standard way, but share that using the nationally recognized standards. And I think we were very successful as Pioneer RX has been one of the more successful system vendors for pharmacists documenting clinical services.
Yeah. The fun part about the JCPP, and I'll give a shout out to one of my old pharmacists, Mimi. Mimi's biggest, I think every slide deck she ever built had the JCPP process wheel on it. It's got a little wheel with 5 sections.
We miss you, Mimi.
Yes.
We used to give her a hard time about that.
We call it the wheel of life.
The wheel of life.
Okay.
That's fitting. Yeah.
All right. So it sounds like where NCPDP attacked kind of standardization of how to submit and dispense in a technical way and getting paid for the format and transmitting that data. You guys are looking at it let's do the kind of, and I'm going to oversimplify this to a degree, Shelly, same way, kind of the same approach NCPDP took, but let's try to standardize the way data is captured, transmitted, and payment models are applied in a clinical services environment with pharmacy.
That's correct. But there's two very important pieces. Number one, NCPDP standards are not really meant for clinical documentation.
Right.
But we harmonized with HL7. So we did the work at NCPDP and brought that work to HL7. And this was important because going back to the mission of the Pharmacy HIT Collaborative, we wanted to make sure that we were integrating into the national HIT infrastructure. So organizations like ONC, the Office of the National Coordinator for Health IT, CMS, were writing into regulation the use of HL7 for hospitals and physicians' offices, if you remember the Meaningful Use Incentive Program. And since pharmacy was not part of that, we still thought it was important to integrate with the same type of standards that the national organizations, the government organizations nationally were touting that we should be using. And that's how we came up with the Pharmacist Electronic Care Plan.
Right. And that's one of the things to think about is historically pharmacy and health, and I almost want to slap myself for saying health, pharmacy and medical insurance have operated in two different worlds, and pharmacists and physicians have operated in two different worlds. It would almost be like in the internet of having to think about, well, I want to send this email to this person and having a whole different language. Giving using those same types of, HL7 and SNOMED codes, it allows you to send that to anybody that can receive it. So it's the beauty of email. You can send it to anybody. Right. It just works because it uses the same standard. This is the same idea, right? Being able to share clinical content over the same standard with anybody who also has a computer.